namely that antidepressants often do not do what they promise and are in fact causing harm to many.
Dr. Steve Hotze is suing over Obamacare's employer mandate.
It's time for a wellness revolution. Brought to you by Hotze Health and Wellness Center. Honest discussion on maintaining health and wellness naturally to enjoy a better quality of life.
He's the doctor fighting to let you keep your doctor.
Now, Dr. Stephen Hotze.
Welcome to Dr. Hotze's Wellness Revolution. I'm Stacy Banfield here with Dr. Stephen Hotze, founder of the Hotze Health and Wellness Center. Hey, if you have not downloaded our podcast, it is so easy to do that. All you have to do is go to hotzepodcast.com. That's HOTZE podcast.com. You can find out great medical information on all kinds of topics. And one really good topic we're discussing today is ADD, ADHD, not just in children, but in adults as well. That is something that everybody's familiar with it. And if you've been diagnosed with it, it'll be interesting to hear more about it. Or chances are you know somebody who's been diagnosed with this condition. So Dr. Hotze, why don't you share with us more about ADD and ADHD today?
ADD ADHD, attention deficit disorder, attention deficit hyperactivity disorder. Doctors label these people with these two names. They claim it's a diagnosis. Well, a diagnosis isn't a labeling of symptoms. All ADD and ADHD are a series of symptoms that we'll discuss in a minute, to which the doctor applies the label ADD ADHD. If someone tells you you have ADD or your child has ADD, the first question that should come out of your mouth is, why? What's causing the problem? Now, the doctor inevitably is going to prescribe drugs, amphetamines for these, and we're going to talk about that a little bit later. And I can tell you, nobody has attention deficit disorders because they have low levels of amphetamines in their body. So let me ask you some questions. Do you lack focus? Are you easily distracted? Do you have a hard time paying attention to details? These days, it's not uncommon to hear people say, well, I'm just ADD. That's why I can't do it. I've even heard people say entrepreneurs, all entrepreneurs are ADD. There's personality types, and we're not necessarily going to talk about that today, but I'll give you a little background. There are 4 personality types: choleric, sanguine, phlegmatic, melancholy. Cholerics are drivers. They're high strategy guys. They're usually entrepreneurs. They're leaders. Sanguine people are outgoing, warm. They never meet a stranger. Phlegmatic are very methodical and detailed and very methodical in their work. And then people that are melancholy, they tend to be very detailed. They like to know what the rules are. They don't like to be blamed for things. And these are personality types. So a lot of what we see in individuals that you may assume that you have ADD, it's just your personality type. You know, some kids get up and go and move about. Some other kids lay around. Everybody's different. And unfortunately, the drug companies have used this as an opportunity to sell drugs. So before you assume you have ADD, you need to discover the underlying cause of your symptoms. Guess what the underlying cause of your symptoms is called? It's the diagnosis. And that's what doctors don't give you. They give you labels because they're afflicted with a disorder called labelitis. They caught it in medical school and they never got rid of it. They don't want to ask the question, why do these or this patient have these symptoms, whatever the symptoms may be. You don't want to treat the symptoms, but that's what the pharmaceutical drugs do, is simply mask your symptoms. They don't treat your underlying problem. Well, while we used to associate ADD or ADHD primarily with children, many adults today are being labeled with this as well. So before you assume you have ADD or go to a doctor who'll prescribe you these dangerous amphetamine stimulant drugs, you really owe it to yourself to find the underlying cause of your symptoms. Now, did you know that research demonstrates that there's a definite connection between hypothyroidism, that's low thyroid function at the cellular level, and ADD and ADHD? First of all, let's talk about ADD and ADHD. ADD is the attention deficit disorder. ADHD is attention deficit hyperactivity disorder. The terms are oftentimes used interchangeably. But ADD is just one of the 3 types of ADHD. ADHD, attention deficit hyperactivity disorder is a chronic condition that includes difficult sustaining attention. It has hyperactivity and impulsive disorders. The symptoms differ from person to person. Both children and adults can be labeled with ADHD. There are three main types of ADHD. The ones that the individual's primarily inattentive. They just kind of wander. They're kind of looking like what's going on and not listening. Predominantly hyperactive. Kids get up in their chair, they move around the room, you can't keep them still. And then there's the combined type where sometimes they're inattentive, sometimes they're very hyperactive. Adults with ADHD may have these symptoms or issues. They can have trouble managing time. Who doesn't? Being organized. Who isn't? Who gets organized that well? There's certain people that are melancholy, and that sounds like that's depression. It's not. That's just a term that the Greeks labeled. We would call that high detail orientation or high D person. They like to organize themselves. A person that's a high A, man, he's going and blowing, giving orders and commands. He wants somebody else to organize for him. But if you have problem managing time, being organized, setting goals, holding down a job, this can be symptoms that get labeled. They label you as ADHD. And of course, if a person can't perform well and has these problems and these symptoms, he just has poor behavior, he's not well disciplined, this can affect your family's finances and your family life. Individuals like this may have poor listening skills. I've been accused of that. I guess it.
What?
Can be easily distracted, have a problem with focusing attention. All of these can affect your life, your career, your business, your home life. They can also affect your golf. You can't focus on your golf game. I know it. I can't focus. I've seen a lot of guys.
I'm sure that's right.
I may start saying when they miss those 3-foot putts that they just have ADHD. They can't focus.
Well, Dr. Hotze, what about food allergies in children?
Well, food allergies are a very common cause of kids' abnormal behavior. Mm-hmm. And we're going to talk about hypothyroidism, but I'm glad you brought that up. The common foods are wheat, corn, egg, milk, yeast, and soybean. The dyes in the foods can also cause problems. They can cause the release of histamine from mast cells in your body. Mm-hmm. When the histamine is released, you've heard of antihistamine. Well, the body releases histamine. That's why when you have an allergy attack, you take an antihistamine, and the histamines affect brain function. They're neuroactive chemicals that affect the neurotransmitters in the brain, and so they can set kids off. I used to have a practice that was strictly allergy, and we took a lot of kids who had been diagnosed with ADHD, and we found their problems were food allergies. Mm-hmm. I could literally turn their symptoms on and off with various food drops. It was amazing.
Amazing.
Well, people with ADHD, with the symptoms, may also have problems with their relationships, poor self-esteem. They can get addicted. And, of course, you get on amphetamines, you get put on that, you're going to get addicted to that, and they can have a problem controlling their emotions. Children with ADHD also have a trouble focusing, paying attention. They can be hyperactive and unable to control their impulses. These behaviors interfere, of course, with their school life, with their grades, and with their home life. Sometimes they want to make you pull your hair out. Look at me, I'm bald. I had 8 kids. So did I have some that were, unruly, hard to manage, undisciplined? Yeah, we had a few of them in that bunch. So here's some symptoms that doctors use to begin to label people. Inattentiveness, hyperactivity, impulsiveness, disorganization, lack of focus, hard time paying attention to details, trouble staying on the topic while talking, not listening to others. What were you saying about that dress you bought the other day?
I don't remember. Well, seriously? You're asking me this?
That's what I mean. Can't stay on topic, okay?
You set me up.
Forgetful, easily distracted. These are common symptoms that we see. Now, could there be a connection with hypothyroidism? What many people don't realize is that an individual with hypothyroidism can have all these symptoms that get labeled ADD or ADHD. Now, the thyroid gland's in the neck. It produces thyroid hormones, which govern our body's ability to produce and use energy within the cells. It governs our metabolism. So low thyroid function, inevitably, when you don't produce enough energy within your cells, it's going to affect the way your brain works. You're going to get, people with low thyroid have brain fog, memory loss, anxiety, depression, inability to focus, difficulty concentrating or performing basic tasks. Oh, you go to a doctor and you go like, I think I may have hypothyroidism. I've got all these symptoms. I can't focus. I can't think clearly. I can't remember things. He says it's normal. I just think what you got is ADD or ADHD. Well, research found that people with generalized low thyroid symptoms have a marked increase in ADD symptoms compared with other family members. So when they check individuals who have hypothyroidism tend to have the symptoms of ADD much more commonly than those that don't. It's also been shown that the prevalence of thyroid abnormalities, hypothyroidism, is higher in children with ADHD than in the normal population. Now, let me give you an example. I have a grandson. He's 5 years old. He hadn't really been focused really well. He kind of walked late. When he was 2, he should have been walking much younger than that. And he just didn't seem to adjust to things right. And he got cranky in the afternoon, and he couldn't focus and pay attention, and he'd throw temper tantrums. And I told my daughter, I said, you know what? This is one of my 5 daughters. I said, I think little guy's got low thyroid. Let's put him on some thyroid. Put him on a quarter grain of thyroid. And in 2 weeks, she called back and said, do you think the thyroid's causing him to nap better in the afternoon and he's not as cranky as he was? He's doing better. He seems like he interacts better with people. And we bumped it up. He's on a half a grain of thyroid, and he's doing wonderful. So thyroid, if you're not generating enough energy within your cells, that's going to affect the amount of energy you generate for your brain. And your brain takes 20% of the body's energy. You got to have energy to think. And if the brain isn't working right, you're not going to function right. You're not going to be able to focus. You're going to be a daydreamer. You're not going to be able to be attentive to anything that's going on. Your mind's going to drift. So hypothyroidism can be and play a key role in the decline in an individual's mental sharpness, his attentiveness, his ability to focus on problems, his ability to think clearly and to be sharp mentally. So when it becomes difficult to maintain sharp focus and memory and clarity, you've got to think, could this be a thyroid problem? It causes brain fog. It can lead to depression, difficulty concentrating, and short-term memory loss. We see this all the time here at the Hotze Health and Wellness Center. Hypothyroidism is also associated with mood disturbances and the inability to really think and do problems. Thyroid hormones are just so very critical for normal brain functioning. In particular, hypothyroidism is associated with numerous cognitive deficits, including lower general intelligence, psychomotor speed, visual spatial skills, and memories. These are studies that have demonstrated this. So I want you, though, to beware now when you go to your doctor, if he says all your blood tests are normal, despite the fact you have all these symptoms of hypothyroidism, he's going to inevitably give you prescription drugs. And it's treated with amphetamines. These amphetamines have very serious and deleterious side effects. Now, let me name some of the medications that you'll see. Adderall, Concerta, Quilivant, Ritalin, Strattera. Some of this stuff is sold on the streets. The kids get it or the adults get it. They end up selling them or giving them to their friends. Now, here's some of the general side effects, and they're serious side effects to these medications to treat these symptoms labeled ADHD. You get nausea. You can become hyper agitated, manic even, loss of appetite. Some of the diet pills are amphetamines. Headaches, dry mouth, elevated blood pressure, dizziness, complete different mood swings, insomnia, you can't sleep well, blood pressure goes up, pulse goes up, and you're restless. You're active all the time and very irritable. These are the side effects that we see with amphetamines. You've heard of methamphetamine? My gosh, this is just legalized amphetamine that the drug companies are pushing on the public and using the doctors as They're drug agents. That's all they are. So between two, let me tell you how bad it is. Emergency room cases for visits by individuals that were taking medication, these amphetamine drugs, is well over 40,000 visits in the last year to the emergency rooms for side effects from the amphetamines that doctors gave patients to overcome their ability to really focus, or they were inattentive.
When they could have benefited from a natural
Could have
desiccated
benefited from-
thyroid.
Yeah. So natural thyroid,
Incredible.
when it's indicated, this is what I believe. If you've got the signs and symptoms of hypothyroidism, then you deserve a therapeutic trial of natural desiccated thyroid, no matter what your blood says. Even if your blood test falls within this huge, wide range of normal, where 95% of the people blood tests fall. So let me tell you, the adverse side effects that I mentioned to you get even worse. These amphetamines can cause permanent brain damage. It can completely upset the neurochemistry of the brain. That a guy or a gal just never gets her brain back. It causes severe liver damage. It can cause inflammation and damage to the heart because it causes an increased blood pressure, and it causes stress on the heart, and it causes irregular heart rhythms, which people can die of when they get an irregular heartbeat. One can hit on another. Next thing you know, they go into VTAC or ventricular fib, and they're gone. So it causes heart attacks. It can cause strokes, sudden death, changes in personality, hallucinations, increased cancer risk, depression, suicide. These are all the harmful and deleterious side effects of amphetamines. Why in the world would you take an amphetamine? It's just wrong. If you don't let some doctor or some school nurse or teacher say, your child has ADD. They take them to the nurse's office. They recommend you go to that doctor. All that doctor does is dispense amphetamines. Don't let them do it to your children. Clean up their diet. Check them to see if they have hypothyroidism. Make sure they get good vitamin and mineral supplementation. See if they have food allergies. So if you're experiencing any of the symptoms that doctors label ADHD and want to find out what the underlying cause is, then you need to go to a physician or a group of physicians that look at things from a natural point of view, that don't slap labels on symptoms and call them diagnosis. If you have any of the other symptoms of hypothyroidism, then that's probably going to be a good indicator that hypothyroidism could easily be the cause of your or your child's attention deficit disorder. As I mentioned earlier, diet plays a very important role in this. I recommend a paleo eating program. Cut out the carbs and the sugars. Those are very addictive. And look, we put these kids, we just feed them junk. We got them on Coca-Colas and Pepsi-Colas and cookies and cakes and candy because they like them, right? It's not good for them, and it does adversely affect their behavior. So you've got to change your eating lifestyle to adopt a more Paleolithic, which means you eat good oils and fats. You eat eggs. You eat butter, fish oil, olives, avocados. Hey, that means guacamole is good for you, right? So, and then you eat good, healthy vegetables. Get them organically if you can at Whole Foods. Broccoli, asparagus, green beans, spinach, kale, whole host of good, healthy vegetables. And then you can also have some meats. You don't need much. 4 to 6 ounces a day is more than adequate. Do that and eliminate your simple carbs, all the pizzas, the pastas, and the bread. Just eliminate that. And when you do that for a month, you're going to feel like $1 million. Then when you eat some of the junk food that people have been eating all their lives, you're going to feel like not going to feel well. So you got to ask yourself, if you've been labeled with ADD, is hypothyroidism a cause of the problem? And you can find out and tell them how they can go to our symptom checker and do that.
Absolutely. You can just go to our website at HWC.com. That's HOTZE, HWC.com, and just take that symptom checker. And I do want to add on to this, Dr. Hotze. someone in my family had been on Ritalin as a child. And when he grew up, he said, I wish I had never been on Ritalin. And the parents felt horribly, but they didn't know any better.
Why did he say that?
Because of the way it made him feel. It just, the effects, how it made his brain, he just couldn't think right. It just really slowed him down. I think that's how he put it. He just felt like he was in slow motion. And so he just hated that drug. And so this is a message of warning. So Dr. Hotze, thank you for saying that. And also a message of hope that there is a natural way to treat your symptoms or your child's symptoms. And so when you go to the symptom checker, there's also an opportunity to download a thyroid report as well. So be sure that you do that. That will also have some helpful information. And of course, you can always call us at 281-698-8698. That's 281-698-8698. We'd be more than happy to have a conversation with you about your symptoms and see what we can do to help you do a 180 and take charge of your health. It would be a privilege to serve you. Thank you for joining us today here at Dr. Hotze's Wellness Revolution.
Information provided on this radio program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution radio program advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this radio program is at the listener's discretion.